All right, well, the city of Tshwane says that it is closely monitoring the typhoid fever outbreak in some parts of the country. The National Institute for Communicable Diseases has confirmed cases of the disease in Gauteng, Northwest and the Western Cape. The city says that only 7 sporadic laboratory confirmed cases were reported since December in Tshwane through the National Medical Notification System, which cannot be classified as an outbreak. All right, let's get more on this. We're now joined via Zoom by the spokesperson for the Department of Water and Sanitation, Mr. Sputnik Ratau. A very warm welcome to you, and thanks very much for joining us here on SABC News, sir.
Good afternoon, Ms. Letova, and thanks for the opportunity.
All right, let's begin here just to get some sort of clarity from you. You know, on one hand, we're being told that there's no need to panic since there isn't any evidence of typhoid fever cases linked to municipal water sources. But we're also hearing, of course, that there are indeed some confirmed cases. What is the truth, and where are we?
The truth is that there are cases confirmed of typhoid, but it is not confirmed that that is as a result of municipal drinking water that has been through the treatment, water treatment processes that are within the South African national standards. And therefore, that has implied that there is no link between the drinking water quality as we know it and the breakout of the fever at this point.
Yeah, so what do you advise us then? I mean, there certainly is some panic in those affected provinces or cities where people are even saying, you know, perhaps you shouldn't be drinking tap water, for example. And that, you know, for many people, they simply cannot afford to be buying water. Tap water is really the only option where there is even running water. So what is your advice then to us this afternoon?
The advice is that where there is running tap water, we should continue using that because it has proven to be of good quality so far. Remember that the standards are common throughout the country because they are set by the department. But in cases where people are in doubt, and doubt can be influenced by a number of things, including misinformation that has actually been around for the last couple of days, then we are saying just for the comfort of those people, they should then look at some practices that might help to calm themselves down in terms of hand hygiene, where they will then wash their hands with soap and water, which we normally say they should do, especially if one has been to the toilet or has changed a baby's nappy. Those are normal things to do. Or also you need to keep your cooked and raw foods separate because they do have a way of affecting one another negatively. But also, where you believe that the water might be unsafe, whether correctly or incorrectly, you might then want to boil that water in a clean vessel for about 1 minute, just so that you can be able to get through that period. But so far, and as you correctly put it as well, the National Institute for Communicable Diseases has confirmed that thus far we have no linkage between the outbreak and drinking water.
All right, then let me go back to my first question then, Mr. Ratau. You have said that you have confirmed that the cases of typhoid fever are indeed, it is true, there are cases of typhoid fever, but you've then said that there's no evidence that it's linked to municipal water sources. So are you then now saying or confirming that you're unable to trace what the source is of this typhoid outbreak? And if not, how long will it take you to do so?
You must remember that that is a process that is undertaken by the Department of Health. And for us, it was to confirm, you know, that the quality of drinking water that is available is actually of good standard. So we can only understand once the Department of Health has been able to locate exactly what the influences would have been to bring us to where we are right now.
And what kind of communication are you then having with the Department of Health? Since I would think that this is an issue that actually wants both of you, that needs both of your attention. So let's talk then about the kind of communication and conversations that you're having between the two departments.
Yes, we are having those interactions, and I mean up to this morning,
Yeah.
We were actually in a rapid response meeting together with the colleagues from health. And those will be ongoing until we are able to actually put a finger on exactly where the issue is, and we will continue to discuss. And obviously, once we have found that, the whole of the South African community will get to know.
So where are you then in terms of those conversations? I mean, you're saying that indeed there are conversations, but my question was really around where are you in terms of those conversations that the two departments are having, just so that the rest of us in the country understand where we are.
Well, those are ongoing, Florence. It's difficult to say this is how far we are. Research and all of that, including, by the way, communicate, or rather, the work that will be done by the relevant laboratories and all that. That's the kind of information that will come together and be able to inform us, as best as we can be able to get that information.
All right. Thank you very much, Mr. Ratau, Sputnik Ratau, spokesperson for the Department of Water and Sanitation. Thanks to you, sir.